Today we are reporting 916 cases of COVID-19 in our community, an increase of 4 cases from yesterday. 2 of the 4 new cases are people working in the agri-farm sector. 488 cases are now resolved. 16 people are in the hospital. 18% of our cases are between the ages of 20 and 29. 17% are between the ages of 30 and 39. And 17% of our cases are 80 years or older. 47% of our cases are male and 52% are female, with 1% unknown. Our community has lost a total of 63 people to COVID. 47 deaths have occurred among residents in long-term care and retirement homes. 2 long-term care and retirement homes are currently experiencing a COVID outbreak in our community. Testing is now available for symptomatic people, those who have at least one symptom of COVID-19, even mild symptoms, and testing is also available for asymptomatic people based on their level of risk, including people who are concerned that they have been exposed to COVID-19. This includes people who are contacts of a confirmed case or may have been exposed to a confirmed case or a suspected case of COVID-19. This testing is also available for asymptomatic people who are at risk of exposure to COVID-19 through their employment. This includes essential workers such as healthcare workers, grocery store employees, and people working in food processing plants. No one who is symptomatic or is concerned that they have been exposed to COVID-19 will be declined to test at an assessment center. Common symptoms of COVID-19 include fever, a new or worsening cough, and shortness of breath. However, other symptoms may be present, such as a sore throat, difficulty swallowing, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headaches. To access a local healthcare provider, walk-in clinic, or virtual assessment, please visit ehealthwindsoressex.ca. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. As well, SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning. I'm happy to report that 2 more long-term care home and retirement facilities have been removed from COVID-19 outbreak, bringing us down to just 2 for ongoing outbreak management and monitoring. Yesterday, we issued our first extended heat warning for Windsor and Essex. For most people, heat-related illness happen when temperatures are high for a number of days, particularly if nighttime temperatures do not drop or the humidity is high. Symptoms of heat-related illness include dizziness, headache, nausea, vomiting, weakness, and confusion. If you experience any of these symptoms, seek immediate medical attention. It is always important to protect ourselves against heat-related injuries, but especially during COVID-19. With normal areas to cool down unavailable, such as libraries, splash pad, it is important to take these additional steps to prevent heat-related injuries. Stay hydrated, drink water regularly, dress for heat, wear a wide-brimmed hat, and lightweight, loose-fitted clothing. Cool down, take a cool bath or shower, or shelter in an air-conditioned location. Limit exposure, look for shades when outside and limit your time to cooler parts of the city. Keep informed, monitor local weather forecast and warnings. Stay up to date by using staycoolwindsoressex.com or follow us on our social media. To manage the use of cloth mask during the heat, consider using cotton material mask. Cotton is more breathable than synthetic fibers and will be more comfortable in the heat. Make sure your masks Fit well, but not too tight. Carry extra mask if yours becomes damp from sweat. Limit how long you wear a mask and only wear when absolutely necessary. Last week, we launched a portal on our website for the public to ask questions. Several of the questions we received last week were about social gatherings. People asked, when can we start socializing and visiting people outside of our own families? To answer your question, currently under the provincial order, organized public events of more than 5 people and social gatherings of more than 5 people are prohibited. This does not include members of the same household. The reason a limit on these social gatherings is important to limit the number of close contacts an individual have. A close contacts are a member of the same household or people that you have extended physical contact. This would mean you were within 2 meters or within 6 feet of another person for more than 15 minutes. Close contacts with someone who is infected with COVID-19 is the most common way to contract COVID-19. The more close contacts of an individual has, the more people they can potentially infect. This is why it is safest for yourself and the community to limit your contacts to a small group and continue to maintain physical distancing and hand hygiene. Thank you.
We'll now take questions from the media. We'll start with CTV.
Yeah, just curious, which 2 LTCs are left?
The list is on our website. Yes, it's. I believe it's updated every day, and it should be updated right now.
Okay. Down to 4, which is nice number. But do you expect that to spike in the next few days because we had a spike at the assessment center yesterday?
We're talking about these long-term care homes. So the idea is if these long-term care homes are doing everything that they should, we shouldn't see any difference in terms of
the spike overall.
Overall in the community. Yes.
Yeah, you had 4 overall yesterday or today, and with the new the assessment center and the spike in their numbers.
Okay, so I hear you. So basically, the 4 community cases that you're talking about that we have seen, and what the spike would look like, it would be a guess because I think right now, if most people who showed up at the assessment centers are asymptomatic, don't know how many of them will come back positive. Based on what we have done, our work in the long-term care home and retirement home, the numbers that we had for asymptomatic people was close to 1% or less than 1%. So we'll have to see what it means. And I know there has been a number of thrown out by many people that how many of these asymptomatic cases exist in our community. But what we know based on an actual data that is from our community, from long-term care home and retirement home, asymptomatic cases constitute less than 1% of the cases in our community. If it changes based on the data, I think that would be worth looking at. But as of now, I'm not expecting that that number would change. In the meantime, I do want anyone with any symptoms to please connect with your healthcare provider or go to the assessment center to get tested, because those are the people who are most at risk of carrying COVID and infecting it to others. So if even people are contemplating, I would request them to go and get tested to have a better understanding rather than just staying home. And now we have more options to get tested, so I think we should be looking at it.
The people that went through the line yesterday, talked to a few when they were saying that they were expecting to get their test online, the results within 24, 48 hours. Would you happen to be able to get those results just as quick and process them just as quick?
Well, I guess it really depends on how these test results are being reported and which lab it end up going. Many of the labs in the province are on OLIS system, which is the electronic system that people can go and check their result. Sometimes the labs are not on the OLIS system, so it's delayed by a couple of days sometime. And in those cases, we get the results directly reported to the healthcare provider whose name is on the requisition. And if it's a positive one, then public health is almost always copied as part of the requirement and the regulations. So if anyone who's coming back positive, we automatically get a report. Anyone who's negative, we may or may not see the result that quickly. And that would help us with our case and contact management.
Any questions from AM 800?
Yes, thank you. I was just wondering, quite a dramatic drop in the number of outbreaks at long-term care and retirement homes. You know, the high was 18 and now we're down to 2 outbreaks. But I just wonder how accurate you think that is, because when was the last time that a round of testing was done to know the true result?
Good question, but what do you mean by the true round of true testing? Because people are, whoever is symptomatic or whoever even is showing any symptoms, they are being tested. And that has been the case with any outbreaks. If we don't trust that, that means we are basically questioning anything and everything that's happening, and that could be a big issue overall, and people will be sick and people will be in outbreak for a year, like never stop. So I think I wouldn't question what is happening in terms of the true sense. By requirement, by education, by ensuring that anyone who has any symptoms or showing any unusual signs, they should be tested. This is a closed environment that we are talking about. Some of the staff, we understand that the staff is not in the closed environment. They are making their trips outside of the home and going to different places. And I think that's where the responsibility to them comes up. And as I said, based on the data that we have had from the comprehensive mass testing in the long-term care home and retirement home, the number of staff, asymptomatic staff, coming back positive was even less. It was 0.4%, if I recall correctly, which is very low compared to what you would say. And then again, if they're asymptomatic, that doesn't mean that they can still transmit the infection. Asymptomatic means they do not have the infection unless they are really careless in terms of how they're conducting themselves. The likelihood of them spreading the infection would again be low. So it's I think we have to put all these into perspective, and we feel that the being proactive and being good on the prevention side would prevent these outbreaks. And anyone who in the long-term care homes or retirement home, if they're having even any mild symptoms, then that's a conversation that we have. Our team have with these homes very regularly. The ones that are in outbreak every day, the ones that are not in outbreak every other day or every 2 days. But we are getting in contact with them to ensure that we are having this conversation. We're asking them every time. We're asking them. We talk about, okay, what's going on with your resident population? What's happening with your staff? Are they using all these PPE? And any deficiencies that we identify, we reinforce it right then. And the hope is we'll just continue to do that until we get to the point of having no outbreaks, and continue to be vigilant and continue to monitor all these people.
Okay, so since that initial sweep of all of the homes and the testing was done, testing has still continued in those homes, is what you're saying?
Absolutely, and I think that has been the case all the time, not in an organized way to test everyone, but anyone who they're suspecting, and the homes do have that opportunity, the ability to swab anyone that they feel who has any symptoms, even mild symptoms. They do that, and then that is ongoing. That happens throughout the year. It doesn't stop or begin with just one event.
Okay, sorry, just quickly one more. Today, 2 of the 4 new cases are agri farm workers. Yesterday, it was 33 of 36. Do you know the total number of cases that are agri farm workers? 916.
I don't have the number right now, but I think if you do the maths, it would be closer to between 90 and 100 that I'm from the beginning of this COVID-19 up until this point. It would be between 90 to 100.
Okay, thank you.
Any questions from Windsor-Essex?
Yeah, just to follow up to yesterday's questions on cases among migrant workers. You had mentioned many migrant workers live in shared accommodation where physical distancing is not possible. If we continue to see a significant outbreak in that population, would the health unit consider forcing or providing alternative living arrangements that are safer for them?
Well, they have to follow some of the ministry guidelines, which provides them a very specific accommodation requirement. It does have some requirement, and the owner operator of these farms who are bringing all these temporary foreign workers, they have a responsibility to house these people if they have a case in that population. So anytime, even if in a shared accommodation, if you have a case, that individual, it's the responsibility of the farm owners, operators, to ensure that they are taking these individuals out from those shared accommodation and put them in isolation, either in a hotel, motel. And if the number of cases are high, and if the farm owner, operator have more than one housing accommodation, they try to cohort them accordingly, that all the cases are in one accommodation and the others are in a different accommodation. So there are a number of ways that they are doing this, but majority of them are going to the hotel, motel, and we'll continue to monitor the situation. If it changes, if there's any concerns with respect to their accommodation, it will be escalated appropriately to engage Ministry of Labor, other levels of government, to ensure that the safety and protection of these employees as well as the community is happening.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Aside from Waterworld, are there any places open for people in the homeless population to go to beat the heat?
I am not aware of that, so I think this is the problem, and that's why always some of the recommendations that we are making is keeping in light of that. There are a number of shaded areas in the city, so I think we need to be mindful of and using them appropriately, ensuring that physical distancing is maintained. I don't want people to just go in crowded places and then try to all get together. So making sure that wherever you're going to cool yourself down, if you have an air conditioner at your home, ensure that it's working, and stay indoor, drink plenty of water, wear light colored clothes, etc., to keep yourself protected and avoid any heat related injuries.
Specifically for the homeless population, do you know if those conversations are being had to try to accommodate them as temperatures rise?
Usually, city has a plan for these type of event, and they work with all the vulnerable population, not only just the homeless population. I am not aware specifically if there is any different with respect to COVID-19, but I'm anticipating that these conversations are happening, and they are doing what they need to do to support them.
Thank you.
Any questions from CBC?
Good morning. The mayor of Leamington says she wants mass testing at the agricultural facilities. Do we have the resources to do that? She wasn't sure if we did.
Well, we're talking about 8,000 to 10,000 population of migrant farm workers in our region. And again, we really have to be careful on what type of answers we are trying to, what type of question we are trying to answer with these type of mass testing. Yes, in an ideal world, if we have the ability, if we have the resource, and we have the right test, maybe that's something that we can consider. And when we're talking about the right type of test, the test that we have right now is a diagnostic test, and it's used to make decisions, clinical decisions, whether someone is infected, not infected, if they require hospitalization, or if they should be going to ICU, depending on their clinical situation. So that's the test that we have. We need to have some kind of a point of care testing that could be very useful in these type of essential workers or workplaces where we are talking about thousands and thousands of people coming in and working. And then that would give you an estimate on that specific day. So for example, if I'm an essential worker, I'm coming to my workplace, and if I am working with other people and may not be able to maintain physical distancing, if my point of care test is negative, then I'm good to work with my colleagues and my other people. But if, let's say, if it's a positive, then I can be sent back home, and then that way we can control it. But if doing the test today, and then if I'm getting the results 3 or 4 days after, and then by that time I'm already infected other people because of my close proximity. So we really have to be careful in what question we are trying to answer. And as much as I like to do more testing, but I think we should be very careful in how we are drawing conclusions on these tests and how we are using it. I'm really hoping that we get a point of care test soon. I'm really hoping that we get a serological test or antibody testing soon. And then when we have that range, we need to have a better plan as a community that how each of these modalities are used, and the results are interpreted accordingly for better public health decisions.
Who is the onus on to get these tests? Is it on you, on the health unit here, or is it on the province?
So Health Canada is the one who approved the type of testings that are available in Canada. I'm aware that the serological testing or antibody testing is already approved. Right now, it's the lab that are validating and calibrating their system to give us an accurate result. So I'm aware of that. Point of care testing, it was approved at first by Health Canada, but then it has gone back to the research status only because of some issues, and hoping that those issues will be resolved soon, and all of those range of tests would be available for everyone.
I apologize. I wasn't here yesterday. Is there any more movement on the pop-up testing sites? Is it happening this week still?
That's the plan. There are a number of logistics that we are working on at this point, and the most important one is getting the permission of wherever we are setting those test sites. And we expect to see either end of this week or early next week as the latest, but we are really pushing forward to get it, make it available as soon as possible for our community.
Thank you.
Any questions from Blackburn?
No, I'm okay, thanks.
Any further questions from CTV?
Just curious, how much do these point-of-care kits cost? Do they have in the States?
They have some that are approved in states, but not necessarily approved in Canada. So I think I'm not aware about the cost, so I can't answer that. But I think when we are talking about these tests and the utility of these tests, we should be talking about the right test and how these right tests should be used, rather than just using this type of testing which is not designed to answer the question that we are trying to answer. And if we are really looking from a real public health goals and response, we need all kind of tests.
So there's no golden test.
No goals in test in my mind. The only goal would be if I know exactly the type of test that I need to use, depending on what is happening today, what is happening tomorrow, and moving forward.